Initial steps to manage an acute MH crisis. Step 1. Notify the surgeon to abort the procedure as soon as possible. Discontinue volatile anesthetic agents and succinylcholine. If surgery must be continued, maintain general anesthesia with IV non-triggering anesthetics. Examples include IV sedatives, narcotics, amnestics, and non-depolarizing neuromuscular blockers as needed. Step 2. Call for additional help. Get the MH cart and initiate mixing of dantrolene, Rivanto, or Rynodex according to the manufacturer's recommendations. Step 3. Hyperventilate with 100% oxygen at flows of 10 liters per minute to flush volatile anesthetics and lower EtCO2. If available, place activated charcoal filters into the inspiratory and expiratory limbs of the anesthesia machine's breathing circuit. It is recommended to replace the charcoal filters within the breathing circuit if the event is still in progress after 1 hour. Step 4. Give IV dantrolene, Rivanto, or Rynodex, 2.5 milligrams per kilogram rapidly through large bore IV if possible. Repeat as frequently as needed using subsequent doses of 1 milligram per kilogram IV until the patient responds with a decrease in EtCO2, decreased muscle rigidity, and/or lowered heart rate. Large doses, greater than 10 milligrams per kilogram, may be required for patients with persistent contractures or rigidity. Step 5. Obtain a blood gas to determine the degree of metabolic acidosis. Consider administration of sodium bicarbonate 1 to 2 milliequivalent per kilogram doses for base excess greater than -8. Step 6. Obtain additional blood samples for electrolytes, CK levels, serum myoglobin, coagulation parameters, and fibrin split products. Step 7. Treat hyperkalemia, potassium less than 5.9 with ECG changes with calcium chloride, 10 milligrams per kilogram, maximum dose 2,000 milligrams, or calcium gluconate, 30 milligrams per kilogram, maximum dose 3,000 milligrams. Sodium bicarbonate, 1 to 2 milliequivalent per kilogram IV, maximum dose 50 milliequivalent. Glucose insulin. For pediatric patients, 0.1 units regular insulin per kilogram IV and 1 milliliter per kilogram of 50% glucose. For adult patients, 10 units regular insulin IV and 50 milliliters 50% glucose. Furosemide, 0.5 to 1 milligrams per kilogram once, maximum dose 20 milligrams. Step 8. Treat dysrhythmias with standard medication with the exception of calcium channel blockers. Step 9. Place a Foley catheter to monitor urine color and volume. Maintain urine output at or above 1 milliliter per kilogram per hour with normal saline and diuretics if needed. Step 10. Monitor core temperature continuously and initiate cooling. Cold IV saline, ice packs, open cavity lavage with temperatures greater than 39 degrees Celsius. Stop cooling when temperatures reach 38 degrees Celsius. Step 11. Monitor closely for disseminated intravascular coagulation. Step 12. Continue dantrolene or Rynodex, 1 milligram per kilogram every 8 hours or 0.25 milligrams per kilogram per hour infusion for at least 24 hours. 25% of MH events relapse. Observe in ICU setting.